I'm going to enter the area, check that it's safe, which it is. I'm going to make sure the doors and the windows are closed to give the patient privacy. I'm then going to wash my hands using the sanitizer gel, just checking the expiry date on that, which is fine. I'm going to use the 7 steps recommended by the World Health Organization. Then I'm going to introduce myself to the patient. Hello, my name's Donna. I'm going to be your nurse for today. Could I ask what your preferred name is, please?
Sophie is fine.
Hi, Sophie. Before we do anything else, can I just check that you can see and hear me all right?
Yes, I can, no problems.
Great. I want to give you an injection today, so what I need to do is just check your full name and date of birth, please.
Yeah, it's Sophie Ruth Wright, 20th of July, 1982.
Marvellous, that matches what I've got here, and I do just need to check your ID bracelet is the same, which it is. Do you have any allergies that you're aware of?
No, none that I'm aware of.
And before we do anything else, can I check that you're not in any pain at all? Make sure that you're comfortable.
Yeah, I'm fine, thank you for asking.
Great. So I'm going to give you an injection of metoclopramide today, Sophie. Have you had that drug before?
I think I have, yes.
Before we go on, I do need to just check the prescription. Okay, great. I just need to confirm that the medication is an antiemetic. It actually makes you feel less nauseous and less sickly. The benefits of that obviously is that you'll feel better, but there are some side effects in that. It can make you feel a little bit drowsy, but that is just temporary, so don't be too worried about that. Okay, what I'm going to do now is just go away, check the prescription and prepare my equipment, and I'll be back. I won't be long, okay?
Thank you.
Then I'm just going to gel my hands again using the same technique. Right. So I'm just going to read through the prescription before preparing it. So I've already checked and had a positive ID, and I know that I've got the right person. The drug is metoclopramide. The dose concentration is 10 milligrams in 2 mils. The frequency is 8 hourly maximum. The date is today and the time is 2 p.m, which is now. The route is via intramuscular injection. It doesn't require a diluent. I've confirmed that the patient does not have any allergies and the prescription has been signed. It is legible, so I can confirm the script is valid. I'm happy that I've checked the rights of medicine administration. So before I prepare the equipment, I'm going to gel my hands again. And again, use the same technique as before, using the 7 steps from the World Health Organization. So I'm just going to check the vial against the prescription. It is metoclopramide. It is 10 milligrams in 2 mils. And then I'm going to prepare the equipment. First of all, I'm going to place the clinical waste bag on the side of the trolley. I'm then going to collect my tray, which I'm going to assume has been washed with soap and water in the past 24 hours. I will then get an alcohol wipe and just clean the tray in a zigzag fashion. I'm then going to collect the equipment. As the patient is of normal size, I would use a giving needle of a 21 gauge, which is usually green, and I would also use the same size for drawing up the drug. I need a 2 milligram syringe, and I'm just going to check the expiry date on these. And they're all fine, all in date. I'm also going to get an alcohol wipe, and again just check the date on that one, and that's fine. I need some gauze just to help me open the vial. The expiry on those are fine as well. And I just need some cotton wool as well. So I'm just going to check that there's no sediment in the bottle, the fluid is clear as it's supposed to be, and also that it is the right drug, which it is, metoclopramide, 10 milligrams in 2 mils, which is great. I'm then going to prepare the drug. So I'm going to open the syringe at the plunger end without exposing the key point at the end. I'm then going to use one of the needles and attach that to the syringe, again not touching any of the key parts. I'm going to use the gauze just to break off the cap and then pop that in the clinical waste. I'm going to open the alcohol swab and I'm going to use that to swab the top of the bottle or the vial, and you would do that for 30 seconds. Then you need to wait for that to dry, which also takes about 30 seconds. Once you've waited that length of time, you're then going to draw up the drug, and we need 2 mils. So I'm going to take the cap off, pop that in the clinical waste bag. I'm then going to pop that into the vial, lift that up. There's no sediment or anything in there. And then I'm going to draw up the exact amount that I need, which is 2 mils. So I've drawn up the drug, I've drawn up 2 mils. I'm just going to check the syringe has no air bubbles in it and just expel those. I'm then going to sheath the needle, pop that in the sharp spins, open another needle, without touching the relevant part, pop that on so it clicks, and then I'm just going to check with the examiner that she's happy with that.
Yes, I can confirm that that's 2 millilitres.
Lovely, thank you. So I've checked everything with the examiner. The prescription is fine. I'm now going to go back to see the patient. Hi Sophie, I've got everything prepared. Are you still happy to go ahead with your injection?
I am, yes.
Okay, that's great. I'm just going to pop my apron and gloves on. Can I just confirm that you have no allergies?
No allergies that I'm aware of.
Great. So I just need to expose the top of your arm. You did say it was all right to use your right arm, didn't you?
Yep, that's fine, no problem.
Great, I'm just going to move this so I can have a look at your skin. That's great. So I'm just going to clean the arm for 30 seconds using an alcohol swab. and then you need to let that dry for 30 seconds. Just going to pull the trolley a little bit closer, make sure that I've got my sharps box there and some cotton wool. So I'm just going to feel the bony part of the shoulder at the top, the acromion process, and then I'm going to make a V on the skin. Okay, sharp scratch. So I'm then going to leave about 1 centimetre of the needle visible, and I'm going to press the plunger to administer approximately 1 mil over 10 seconds. So it should take about 20 seconds to administer the 2 mils. And then hold that in place for about 10 seconds and then quickly remove it. This then goes straight into the sharps bin. There's no need to remove the needle as this could increase the risk of sharps injury. Check that there's no bleeding, which there isn't. There, you're all done there, Sophie.
Thank you.
So I'm just going to remove my gloves, pop them in the clinical waste bag, and then I'm going to gel my hands. Again, using the same technique over the 30 seconds or so. I then need to sign the prescription. So I'm just going to check it is today at 2 o'clock, 10 milligrams in 2 mils of metoclopramide, and I'm just going to sign and date that. I'm then going to remove my apron, pop that into the clinical waste bag, seal the bag, and that then goes into the clinical waste bin. Okay, Sophie, that's you all done. I just want to make sure that you're nice and comfortable.
Yeah, I'm fine, thank you.
Okay, I'm just going to give you your call buzzer there. It's just on the side here. If you need anything at all, if you can press the buzzer, I'll be quite nearby, so I'll be able to come and help you. Is that all right?
Yeah, thank you very much.
Do you have any questions or anything before I go?
No, none, thank you.
Okay, lovely.